The first step in the implant process is appropriate education of the patient. This can occur from the implant physician or a specialist nurse trained in occipital nerve stimulator education. It is important the patient reads the patient information from the implant manufacturer and discusses questions they may have with the implant team. Having an educated patient with a realistic expectation of the range of treatment success and outcomes, as well as side effects and complications, is important. Some centres will have the patient reviewed by a psychologist to gauge the patient's understanding, treatment expectations and desires for the therapy. Generally, a trial of the therapy is conducted before deciding whether the patient is responsive to the therapy. The trial usually occurs within a theatre or day surgery setting and is performed under local anaesthetic, sedation or occasionally general anaesthesia. Usually, percutaneous temporary electrodes are placed without incision over the greater occipital nerve under fluoroscopic or ultrasound control and secured to the skin. This generally takes 15 to 30 minutes. The system is programmed to achieve the correct area of pleasant paresthesia, and the patient returns home with a diary card to record headache frequency, severity and medication intake. A trial is conducted for 3 to 10 days and the leads are then removed. The results of the trial are reviewed by the implant physician, and typically if more than 50% headache severity or frequency reduction is achieved, the patient is recommended for an occipital nerve stimulator implant. The implant occurs in a surgical theatre, either again under sedation or general anaesthesia, with the operation taking 1 to 1.5 hours. The patient will generally be discharged home the next day. For the permanent implant, either percutaneous wire or paddle electrodes are similarly placed over the greater occipital nerve via open incision, and the leads are tunnelled under the skin to the pulse generator pocket and connected to the pulse generator. The pulse generator can be a primary cell battery which lasts 3 to 6 years, or a rechargeable device that lasts 9 to 20 years. The patient is seen for a postoperative wound check day 5 to 14, and generally seen for routine review at the 1, 3, 6 and 12 months post-implant to ensure optimal functioning of the device in terms of pain reduction. It is important for the patient to return to the primary physician managing their headache so that appropriate medication reduction can then occur.